All right, go ahead, Barbara.
Hey, Barbara.
Okay, there are two rather different questions. The first one has to do with treating mold and mildew in environment. If
Okay.
they're not because of rain, we've got wet stuff. I know you mentioned savory before, but I think there was more to it than that.
Yeah, well, I actually have been researching this a little bit, and we came up with, there's a particular oil that works really good for mildews and funguses and things like that, both in the environment and in the system. And it's called Benehi. And so it was one of the things actually we were going to make available in a couple of weeks. It took me a while to find a good source for it. I believe it comes out of like Japan or something. And so if I understand it correctly, you could simply be diffusing it if there's an area that is, hit pretty hard and you really need to knock it down. Probably in alcohol, several drops in alcohol would go through and do it. Then either a bath or a couple drops internally for, fungal conditions, or, I don't know about the toe funguses. The information that I got didn't really address that particular aspect, but it's supposed to be very good for the environment, when you're in a wet, moldy time. And so it's not super expensive. It's not like some crazy expensive thing. It's going to be probably like African bluegrass price or something, like $20 a little bottle or something. And so that is probably going to be significantly better than anything that we've done before, because it's very specific to the plant. It's actually what the plant even does when it's alive. And so I find it to be very interesting. I've actually never really played with it too much before, but the person that I got it from is quite an expert, and he's played with it quite a bit. So I would say, I take it for his word.
Great.
Yeah.
Now people are asking, how do you spell that? When
It's
comes
like
out?
Benihi, something like that. We'll put it on the site tomorrow. Yeah.
Thank you.
Yeah.
So diffusing or in a spray bottle with alcohol, or is
Yeah.
diffusing?
Yeah. Should be like if it was, because like up in the northeast there, you guys get hit real hard with snow and rain and all that. I would probably diffuse it in those times. But if there was like a spot, like say in the house where it was growing quite substantially, I would hit it with a spray bottle. But even diffusing it should help you, with potential allergies, and taking it internally should also help.
Great. And how many drops per ounce you were spraying?
I'd probably do like 20 drops per ounce. If I was trying to knock it out on the surface, like there'll be a mold like growing in the bathroom or something because of the wetness.
Okay. Thank you.
Yeah. We've been looking into that one for quite a while, and I reached out to some of my peers and just said, what would you do for this? And I didn't have like tons of notes. And so a lot of them gave back to me what we were already doing. But this one particular person, like this is his jam for that. So
Now, as far as people are wondering, does that work for black mold as well?
I would think, I haven't worked with it long enough to know, but I would say most likely probably.
Thank you. The second question, I've been feeling like I'm being more drawn into the collective unconscious energy lately.
Yeah, you and me both.
And so I was wondering if the psychic protection class, segments 2 through 4, would that be good to work with, or is there something else you would recommend?
Honestly, I would probably go back and work the Sacred Fire booklet.
Okay, the whole booklet or a particular part of it?
I would probably work the whole booklet.
Okay.
Yeah.
Thanks so much.
Yeah,
Emphasis
you're
on a
so,
particular part or just go through it?
no, I'd just go through it.
Okay, thank you.
It's gonna help you kind of remember who you are and who you aren't.
That sounds perfect. Thank you.
Yeah.
Go ahead, Mary Ann.
I had a question regarding
Hey, Marion.
I as I've aged, I've realized you know, I have one problem that I resolve and another one pops up. Everything seems to be related. I'm
Mhm.
diabetic and I'll
Mhm.
get the diabetes under control, and now the blood pressure has spiked
Mm.
once again. And I have questions regarding some of the protocols where we're working with breath. I mean, I know my condition isn't necessarily related to that, but I just have a question. Would some of the breathing exercises raise it? And
Shouldn't raise it.
okay,
But yeah, like when they put you on blood pressure meds, like is it a beta blocker, alpha blocker?
I'm on lisinopril.
Lisinopril. Look that up. Spell that for me.
Lisinopril. I'm not sure.
Okay, got it. No, I got it.
It's so, I've had been on it for so long, I forget what it even was.
Have you had any heart failure
I have,
diagnoses?
no, I haven't. And I take hydrochlorothiazide. I've been on that for both of them for a long, long time.
Okay. And no heart attack or anything like that?
No, family history of heart in my father.
Okay. It's an angiotensin converting enzyme inhibitor. I'd say that we'd like to target your kidneys.
They are problematic. Not, I mean, I don't have a diagnosis, but she's watching them carefully and they appear to be a problem. A beginning one. Anything you can recommend, I'd be most grateful.
Yeah, let me go through and evaluate you, and we'll we have her email.
I think I have your email, don't I, Mary Ann?
I believe so, yes, it's.
Yeah, we'll email you a little protocol for that.
Okay, thank you. I would be grateful for any suggestion.
Yeah.
Yeah, I'll make a note. We'll get you a recommendation.
Thank you so much.
And then somebody was asking, is there a protocol for restless leg syndrome?
It's a little bit hard to treat that one. There's usually a bit of either magnesium, iron, or folic acid deficiency with that. Is an issue with the basal ganglia. It's a bit more complicated than just simply taking a particular oil. We are going to start trying to tackle things like that with further development of the vital centers. I think if there's a way we could treat it. Let me check my notes here. Yeah, we're gonna have to develop a protocol for that. You know, I have other ways of doing it, but it's not with oils. I'll start working on it and trying to get something back to you sometimes.
I just want to go from the top. And again, you guys can always unmute as well. My partner is having an angiogram done tomorrow. Are there any oils I can use to help him post procedure?
Yeah, definitely stick with the post. Um, do you have poplar, by the way, poplar balls?
Spray.
Yeah, the spray would help somewhat. You can spray it on chest, but if you have the oil, put 6-8 drops in your hand, rub it with some massage oil or lotion, and then rub it in an area like on his chest and abdomen. You know, try not to disrupt anything that they've done. I know they go in through the groin, but don't rub on the chest area too much, but just like get the oil in. The other thing is like about 24 hours, you know, after the angiogram, if you happen to have Greenland moss, a couple drops internally. If you don't, just use some sort of lymphatic work, you know, lymphatic blend, chocolate root cleanser, you know, something that moves the lymph, helichrysum, and go through and just, you know, rub it on his body or apply it to the joints, you know, in a neat application.
Go ahead, Wendy.
Hey, Wendy.
Hey, Greg, the weekend was amazing. And I had a
Thank you.
reaction.
What kind of reaction?
Sunday night, I wasn't feeling so terrific, so I went to bed early. I woke up Monday, I felt flu-ish, not bad, you know, just sort of mild flu. And then by last night, I had pains poking up out of nowhere. There was no way I could lie that I was comfortable.
Like what parts of your body?
Well, my right haunch, which, you know, there's always a sciatic thing going, you know,
Oh, like the hip.
hip, but, you know, there's always some threat of a sciatic thing happening. But in addition to that, there was also something that felt like burning. And it took me a very long time to understand that it was nerve pain.
Yeah.
Yeah. So, and then, you know, an elbow would hurt or a shoulder would hurt. I mean, it was like popcorn. And now
So
I had decided that since I didn't feel so hot on Sunday, I decided not to eat. And so I was fasting, which I figured would give my body a break and let it sort of do its thing without me shoving stuff in on it. And actually, right now, I'm okay. It turns out that if I'm vertical, there's no pain. If I'm horizontal, there's not as much pain as there was last night, but it could. And I don't know.
And so the pains came up mostly on the limbs?
Well, there was, the big pain was in the right side of my butt and hip. It seemed to center around my waistline, which made no sense to me at all, because, you know, what's there, for God's sake?
And so that's something that flares up on you from time to time?
I hadn't gotten the waistline thing before, but the butt and hip thing is, you know, not unfamiliar, let's just say.
Okay, okay. Yeah, the waistline thing is actually your abdomen, the muscles in your abdomen.
Okay.
Kind of goes along sometimes with back pain, like and sometimes like back pain is actually more your abdomen than it is your back.
Okay. Okay.
That you have the hip issue. I mean, that sounds kind of like sciatica or piriformis syndrome.
Yeah. Yeah.
It can go along with that somewhat, but
Yeah.
that you had flare up so shortly after the class is odd. That you had the popcorn thing happening in your limbs. So like a couple of things, you know, one thing is, you know, we're shifting things around and your
Mhm.
body's shifting around. You could have had a
Yep.
little bit of a fight flight response
Uh-huh.
that could have caused some of this. And if not, definitely you had some tension or spasms coming up, and
Yeah.
who knows why, but, you know, I think it was smart for you to take a little break.
Mhm.
I'm not sure if the fasting helped, but it sounds like something you use a lot for yourself. So it's probably a way for you to feel centered and balanced.
Mhm.
And so I would say, you know, do it for what you had planned on doing it, but,
Mhm.
you know, give yourself maybe a little bit more of a break, you know, like maybe the
Okay.
evening, and then tomorrow, maybe let's have you work with marjoram and you can just inhale it. Not even a particular pattern, just, do you have some marjoram?
Oh, yeah.
Okay, so let's have you inhale it, and when you feel like you can apply some to your body, let's have you put it in lotion and apply it to your entire abdomen,
Mhm.
especially right under the ribs, and then especially also right below your belly button. You
Mhm.
know, those are two, the area below your belly button is causing the pain on your waistline.
Mhm.
And so a couple applications should knock that out. You know, it's sometimes when the back is a little compromised, the abdomen will overwork to try to manage the back and the spine, and it just
Mhm.
develops trigger points. I mean,
Yeah,
it's just
okay.
one of those things, like, you know, very, very common.
Okay, that's good.
The issue is that it's referring pain to the back, and so most people think the issue is actually the back when it's really the abdomen. You know, we really don't take into account that there's referral pains, and so I mean, I still have to go through and look at the charts. Excuse me, and
Okay.
so do that for like a day or two, and
Yeah.
then email us and let us know how you're doing. And I just want to make sure that you're nice and stable.
Okay. Yeah,
Yeah.
and I think that I will I'm sitting here looking at the 11 A+ oils and thinking, no, not yet.
Yeah. Give yourself a little break. Yeah. It was a good intense class, but give yourself a break.
Yeah. Thanks so much. I
You're so
appreciate it.
welcome. Yeah, I'm glad you enjoyed.
My mom had surgery on her right hand wrist to resolve nerve pain problem. The wound isn't healing as quickly as it should be and is oozing where the incision was made. She also has lung cancer and is 2.5 months into a 3-month break from the 6 months of chemo treatment she was doing.
I'm glad you provided that, because that was going to be the first question I was going to ask. Is a lot of times when we see this, it's in cancer patients. And so give me a second here. Let me just validate a couple things. And okay, how far along is this?
How long ago was the surgery?
Yeah, like whatever the wound is that is having a hard time closing. Is it the surgery site or?
Yeah, it sounded like it was where the incision was. The letter. Surgery was 1 month ago, and yes, it's where the incision was made. The oozing is.
And what's the doctor say? I'm just curious.
Not sure. The doctor is not sure, or maybe she's not sure what the doctor
Okay.
said.
And it still has stitches, correct?
No, they were removed.
Okay, I mean, this is what I would do. This is what I would do if it was me. Is the oozing is potentially some inflammation or even a little bit of maybe infection. Let's just say inflammation for right now. So the very first thing that I would actually do is put a few drops of helichrysum in on the area. This will help reduce the inflammation. It will help to clean it up a little bit, and it will reduce any sort of pain. You could also use tea tree if you suspect more infection, but let's stay with the helichrysum first. Now, here's the thing, is like when you have a wound like that, it depends on how puffy it is in and around the wound. If there's a lot of puffiness, you would want to use like some German chamomile and like a massage oil and rub it in and around the area. The German chamomile will help fight the infection and help displace some of the fluid. Now, let's step away from that and go back to just what we know. You know, she's had surgery and she's been dealing with cancer. And one of the things that I would like to look at, like for any wound healing, is giving them black cumin internally, like 2 to 3 drops. If you don't have it, or you know, there's distance between you guys where you can't get it to her, you know, you can have drop shipped from us, or you can go online at Amazon and get black seed oil, or, you know, capsules, and have her take like 2 or 3 of those daily. The other thing that I'd like her to see would be to use galbanum, and she could take it internally, or in this particular case, she could do inhalation. But that combination usually helps reduce inflammation and helps the wound to heal. That combined with the helichrysum, I think, should be a 1-2 punch. Here's the difficulty, is depending on age, the health of the person, the cancer, how much chemo, sometimes it's really rough getting wounds to close. And you know, the doctor, like they said, there's no rhyme or reason. Sometimes they just take a lot longer, and sometimes, I mean, I've seen them not close after a year or two. I'm not saying that's what's happening here, but it's a little bit of a different set of rules. You know, a normal person, you know, you're looking at a certain amount of time. But when you deal with a cancer patient, it depends on the constitution of the person. And so part of what we're putting forth in this particular situation should help the infection and the wound to heal a little bit. And it should improve their constitution somewhat, you know, basically their ability to heal. If I was in, you know, this person's shoes, this is what I would do for myself. You know, even if you do part of it, it should have some help. Yeah. And then maybe in a week or so, after they're doing some treatment, you can let us know.
Go ahead, Troy.
Hey, Troy.
Hey, y'all.
Mhm.
Hey, I was just checking in about the respiratory stuff that's going on with me.
Mhm. Mhm.
I went and got like a COVID test yesterday and tested negative.
Good.
And then I did like an at-home one that also came up negative.
Good.
But you know, I'm wondering if maybe I could have like one of the variants or whatever.
I blasted you pretty hard. You probably had it. Probably thought no.
Wow.
Yeah.
Thank you so much for.
Yeah, you're so welcome.
working on it. So I'm still noticing like the last couple of nights, like particularly at night from like maybe 9 until maybe like 3 in the morning, it's still real hard to breathe. Like I almost feel like I'm manually breathing.
Yeah. It's a complaint with that, especially after the fact. And so, have you been breathing like HISSUP or the respiratory support or anything like that?
Yes, both of those. I have HISSUP diffusing on 2 diffusers in my bedroom,
Okay.
like all day, and then I've been doing the deep breath and the immune support. And
So
eucalyptus.
the other thing I'd probably have you use is helichrysum, like just inhale
Okay.
helichrysum.
I actually have been doing helichrysum because I have been using your the protocol.
Mhm.
So I've been going through that. It's like helichrysum and thyme, and I can't remember the other two.
Is it helping at all or no?
I think so.
Okay.
But then like last night I did it and it seemed like it helped, and I kind of nodded off, and then like an hour later I woke up and it felt real hard to breathe.
Do you have yarrow?
I do.
Let's have you inhale yarrow and take some black cumin internally,
Okay.
like 3 or 4 drops of black cumin
Just per day.
per day. Yeah. You know what it looks like to me is inflammation in the lungs. which goes along with.
Okay.
Yeah.
Okay.
I'll look at you
I'll
again
look at
too.
And then as far as exposure, like isolating and stuff, like, do you think that I should keep doing that, or can I? get
I'd say
back
for a
to
little
work?
bit, but you're probably not contagious.
Okay.
If you showed a negative for your test, I got it the first time it came on.
Okay.
Yeah.
Okay. Thank you so much.
Yeah. I probably left you really congested when I worked on you, but I was like thinking, "Ugh, let's just knock this out."
Yeah, I had a lot of energy Saturday night.
Yeah. Sorry.
That's all right. Thank you so much.
You're so welcome.
Greg answered a question about itching scalp over a weekend. I'm wondering if alpha brainwave oil to use on the scalp.
No, you just need to like help it to expel out. Like what happens with especially the class on the weekend is, the brain is expelling and then it gets caught in the scalp somewhat. And so something that just makes you expel, like it could be as simple as something like Palo Santo, could be chakra root cleanser, something like that. You can inhale with your awareness up there, or even put several drops on top of your head. I was blending today and I spilled several drops of rue on top of my head, and it felt quite nice. I kind of laughed. I was like, oh, an angel must have knocked over a bottle and felt that I needed it. It was nice.
Somebody else shared, also had extreme flare up of nerve pain on right ankle on Sunday after class. Began vital centers inhalation, but haven't been able to get past uvula.
Like as I was sitting here thinking about it, the thing that happens sometimes, it's unique just to nerve pain. And I'm not saying this is exactly what's happening, but if I sit and think out why is there a little bit of flare up, is like nerve pain actually eventually will kind of start to go away a little bit, but it's not because the situation has gotten better. It's because the nerve has gone to sleep. I have that issue from a bunch of nerve damage in my right leg. And the sensory nerves go to sleep a little bit, and I actually lose a little bit of muscle mass. And so, not a lot that I can do with it other than just keep myself comfortable. But, the damage was done 30 years ago. And so sometimes what happens is the nerve in a medium amount of pressure, the nerve becomes excited. With a lot of pressure, it goes to sleep. And when it goes to sleep, you start losing muscle mass a little bit, and some damage is being done to the nerve, but you're not really super aware of it. And so sometimes what happens is as you treat it, you go back through the phase of medium amount of pressure and the nerve gets excited. So I would say, for both this situation and the prior situation, let's also just keep that nerve comfortable. So you can use the neurological nerve pain, but you can also just use corn mint, peppermint, some sort of mint on the area to help reduce some of the nerve pain. And so if you don't have that, Eucalyptus citrodora is always good, just to help release inflammation and things like that. And so for both of those, try that. Put the mint or the neuropathic nerve pain in some massage oil and rub it in on the area.
Go ahead, Jenny.
You, Miss Cheney.
You're muted. We can't hear you.
Oh, sorry. I was talking this whole time.
Yeah,
Hi. I have
I
a,
was hearing you on the inner worlds, but I couldn't quite translate.
oh, I'm sure you can see more.
Nah.
I have kind of a pedestrian question, Greg. I
Yeah,
have,
fine.
as I'm using these oils, I'm going through the bottles more, which is
Mm-hmm.
great. However, I don't know what to do with the empty bottles, and it's hard for me to toss them, especially the angel
Yeah,
oils.
yeah,
So I it's weird, but I keep these empty bottles and it's adding visual clutter, which I don't like. But I'm
Mhm.
especially the angel oils. It's hard to get
Sure.
rid of.
I mean, that's a valid question. You know, for us here, we can't really reuse bottles because, it's a business and we need to keep everything clear, clean and clear. But for you, you can always use it to add, say you want to break a bottle up or you make a little blend or something like that. You can clean it out with some alcohol and do it. I hear you though. I have literally an old suitcase that I throw all those old bottles in, and I'm like, at some time I'm gonna find something to do with them. I haven't really, but I use an old suitcase so that they're not cluttering up the area and I can move them away, but they're still all contained. And so
Okay. So
I don't know
basically,
that I have, I
just
don't know.
buy a new suitcase.
Or find an old suitcase, like find an old suitcase, go to a thrift store or something. Yeah,
Start your collection today.
I think the suitcase that I have
stop
doesn't
right there
even,
with the old suitcase.
yeah, I think the suitcase that I have doesn't even have wheels on it. It's like that old, so.
Okay.
Yeah.
All right.
So,
Sorry, but that
yeah,
actually
I don't,
doesn't help.
I mean, if you really wanted to clean them out, you could always boil them, but, yeah, it is a tough one. Recycling is always a good choice. You could
Yeah,
just put
but
them into recycling.
it's the angels labels. I've gone through
Oh,
3
so how
bottles of
about,
Archangel Michael already, and I can't throw any of the bottles away because it's Archangel Michael.
add a little alcohol to it to get the oils out, and then rub it on your body and your skin so that you know that you've gotten all the molecules out,
Mhm.
and then you can just return it to the source.
And that would be what? Recycling?
Just you can take the bottle, take the label off the bottle if you don't want to throw the label away,
Yeah.
and then you can burn it to return it to the source, and then those bottles can go off to recycling.
Okay, so actually put the bottles in fire, is that right?
No, the labels, like
The
if you're
label.
concerned even for the label. There are certain things I don't put on the label because I don't want them to be thrown in the garbage can, like the holy names and things. So,
Yeah. Yep, exactly. Okay, thank you, Greg.
you're so welcome. Give me just a second while you black it out. Okay.
And he will be right back. See more of your questions, so we'll make sure we keep getting to those guys.
Sorry about that. Okay, so more questions?
Again, you guys can always unmute. I'm gonna go through here. Sometimes I feel electrical energies moving around my brain. I noticed that since doing the vital centers.
Yeah. Yeah, there's different, we think of energy as just being life force, but there's different kinds of energy that make up the life force. And so one of them is more of a electrical kind of feeling. So yeah, you would be accurate in what you felt.
Chris from the last couple of weeks has a follow-up. He's the one with the groin strain.
Oh yeah, how you doing, Chris?
During physical therapy evaluation last week, the therapist ordered x-rays of my hip and pelvic area.
Yeah.
Turns out there is advanced degenerative changes in the left hip with complete superior joint space loss. I've been treating the pain with the peppermint topically, internally been doing black cumin and galbanum, frankincense. For the inflammation topically, I've been using ironbark, eucalyptus, and
Yeah.
yarrow.
Okay, good. So let's stay on that regimen for a little bit, because this is starting to be a little bit more of a big picture. I suspected that a little bit, but I was hoping that was wrong because you sound too active, too young.
Yeah, me
But,
too. I was hoping that was the wrong.
Yeah. Not the answer I was thinking was going to come back. And so there's still some space between the head of the femur and the pelvis.
They said there was the superior joint space loss. I haven't seen the x-rays myself. Hopefully I'm going up for another physical therapy appointment tomorrow. So hopefully the therapist or, someone who's a little more versed in radiology can actually show me. So I'm just
Okay.
basically going off what they told me verbally, and then I was able to download the document that kind of spells out the radiologist's findings.
Okay. So I mean, first phase is reducing inflammation, and then after that, we want to try to save whatever cartilage is there, and that actually can be done quite well. Like if there isn't substantial loss, you can really buy a lot of time. And so, how old are you, by the way?
I'm 58.
Wow, you sound younger than 58. So good for
Yeah,
you.
I feel younger than 58.
Give me
too,
some
so-
of that. Give me some of that. Okay. Basically a combination of, we make a thing called joint blend, but you can take like rosemary and pine, and you can use cedar or juniper. I tend to use cedar, but you can use juniper as well. And so you're getting more blood to the joint by, you'll go through and you'll apply it, and you can put it in a base of alcohol. You can put it in a base of like a massage oil. It would be a daily routine. Like, you just do it at the end of the day or something. It's nothing major, but the rosemary is going to help you get more blood to the area, but then also move the blood out. And so, one of the things that happens when there's starting to be some degeneration there is the blood will start to pool, and there's some spasms in and around the joint. And so this combination does help reduce some of the spasms, which allows fluid to move in and out of the area. The rosemary gets blood to the area, and it's moving blood to towards the brain, so it's getting it, out of the area and moving it upwards towards the heart and the brain. And so it's, they refer to it as being a cephalic, basically it just means moving to the brain. And so the cedar is a venous tonic, and you could use juniper instead of pine, or juniper instead of cedar, but the cedars are really good venous tonic / lymphatic tonic, and the pine that I'd like you to use is Sylvester pine. Scotch pine is actually still considered a type of Sylvester pine, but it's like a lower grade of Sylvester pine. And Sylvester pine also stimulates a little bit of cortisone to be produced in the area. So it will act as like a preventative of inflammation. If there's inflammation there, we'll kind of knock it out a little bit, but it will definitely help you stay like active without having so much pain or inflammation in the area.
Yeah.
And so, a lot of times with just that and just being aware that, there's potential spasms that come in that hip, because like if I take my finger and I pinch it right here, in 2 hours, this joint above becomes pre-arthritic. That like just that much tension in the area will actually start to cut off the blood supply to the cartilage. And the cartilage doesn't have its own blood supply, so it's dependent on the tissue around it. And so if you can keep blood moving through that area and reduce spasms, it could even be like sitting on one of those therapy balls or a tennis ball, or, getting some massage or fascial work done on the hip from time to time. It doesn't have to be all the time, just time to time. And it will buy you a lot more time.
Wanted to add in there is that Chris actually has some Sylvester pine, so I've been using that also as topical.
Tremendous.
I forgot to add that in there. And 2 other quick things. The joint blend that you mentioned, what is the name of it that you make?
Joint
And does
relief.
it,
Joint relief. Joint relief.
and does it contain most
Yeah.
of these oils?
It contains that, and I augmented it a little bit with like turmeric and ginger, and made it a little bit more of a complicated blend, but you get all the nuts and bolts of what we're talking about and a little bit extra. Yeah.
Okay, and last thing that I want to mention is I was listening to part of your class while Chris was taking the review over the weekend, and I actually went out and purchased some of the, I think it's Wolbazine, is how you pronounce it?
Oh yeah.
Yeah, and let me tell you, I was probably taking that for 2 days, and I've already started to feel some improvement along with the oils, my body acclimating to the oils. The patient here has been behaving itself a lot better as far as pain goes, and it more starts to feel painful towards the end of the day.
Yeah. Wolbazines are incredible for joint issues. Like usually, like the place I've used them the most is in hip issues, and actually, as weird as it sounds, whiplash syndromes.
Okay.
And the thing is like you can really like utilize those Wolbazines, and you can actually slowly over a period of time increase the dosage to where you can stay off like ibuprofen and things like that, or just taking minute dosages. But most times we got people off of doing the ibuprofen kind of things, naproxen, things like that, just because we're trying to also protect their liver and gut function, and they bring substantial relief. And even though you're taking them in between meals, they still would have an impact on your digestion, which can get thrown off with having an issue like this. Not massively, but a little bit. But they are, I remember a couple of times I just lived on those things. And, they were night and day. The cycle of pain meds has been, lot, none, lot, none, lot, none. And so, usually when I would have an issue is when they were giving nothing for the inflammation or the pain, and, just having injuries from my youth. They would be pretty debilitating. I'd start taking those Wolbazines with some oils, and God, it was just super bearable again.
Yeah, no lie, 48 hours and I started to feel the difference. And okay, I know we've been spending a lot of time. I got one more quick question because I know there's other people I'm sure who want your time. Solomon Seal. Any opinion on that and whether that would be good?
Love me some Solomon Seal. I mean, it could help. I mean, the area that it would help is not so much the cartilage, but it would keep the bone stronger, because as you get closer with the cartilage thinning, there's tendencies for the bone to start being affected a little bit. It's traditionally, I've always used it to treat broken bones. But, things like low bone density and things like that, or when a joint's been compromised, in old school, they did use it for pain syndromes. And so, it would still fall in with something to be used in this kind of thing. And it's also like a little bit of a tonic for the system. And so I really like Solomon's.
Okay. Greg.
Hard to get. Like, be sure that like when you get it in capsule form versus the tincture. Sometimes the
Capsule, okay.
tinctures, sometimes the tinctures aren't nowhere near as strong. And so if you keep going deeper, like say you're on Amazon, you keep going deeper into it, eventually you'll find some capsules. If for some reason you can't, let us know, and I'll tell you the company that you can just go direct to and get it. And so there's still a couple of companies that do some of the old school herbs, and that one's super old school.
All right. So
The other one that
capsules.
the other one you could think of is Lobelia, and again in capsules, not tinctures. It's fascial, it helps to relax your fascia, it helps to relax your diaphragm, and it's a strong antispasmodic. So it can help to deepen your breath. Just 1 or 2 capsules a day is all you really need, where Solomon Seal, it's doing something different, but you'd need to take like 4 or 6 a day for what you got going on. Lobelia, 1, maybe twice a day, even just once a day, and you would find substantial relief, especially in that like stiffness or when you wake up and it takes you a little while to get unwound and moving around. If that's happening, Lobelia can help. Or just when the body starts to be in more pain, the tendency is for the body to tighten up to try to protect that joint. And it's hard to override it mentally. I mean, sometimes you can a little bit, but you just take a Lobelia and it starts to fade away.
Okay. And is that Labilla?
Lobelia. Yeah.
Lobelia.
Yeah.
Okay.
And the other thing is like getting it in capsule, it prevents you from, sometimes people make it, but in a homeopathic version of it, you just want the good old fashioned herb.
All right, Kirk. Well, thank you very much for your time.
You're so welcome.
For spending it with me. I appreciate it.
Yeah.
Have a great day.
Back to the one where the partner is having the,
Angiogram.
they're also wondering, I don't know if it's a topical issue, but if they do slow, deep breaths with the lymphatic blend or CRC, can they do that? Will that be
Like for the first day or 2, I would even you could even let them go with the breath if they want to. That's fine, but maybe just a few drops on the wrist if they don't want to put it on the chest. I get it. I don't know that I would want it on the chest. That's why I was saying real light, but just put several drops on the wrist, or just you can have them just inhale it.
Can you apply the angel oils to your body?
Yeah, sure. Take a bath in them, apply them on your wrist, dab them on your chakras.
Are people who have not been previous students of Greg allowed to join this weekend's class? Like the stress one? Yeah, any person can sign up for
The
any
stress
class.
class? Yeah.
No, I think they're asking for the free weekend classes.
Yeah.
Oh, yeah.
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 It's open to all.
Yeah, sorry.
Yeah. I mean, it helps if they have some oils. And so, if they're with a friend, maybe they can share oils with a friend, or, say they're from another company or something like that. Yeah, just, break them out. Yeah, just use whatever you got.
Got a lot of Lobelia fans, and then another person, wait, what? What does Lobelia do?
Yeah, so Lobelia is used primarily for respiratory issues, especially when the diaphragm is really tight. You're having a hard time taking a breath. So things like asthma, things like that. But it also relaxes the body and relaxes the fascia in the body. It's a very strong antispasmodic. Can even help like relax the jaws a little bit. You know, when in the old days they would call things lockjaw, like when the jaws would get really tight, or a reaction to like a dog bite, like rabies or something like that. You know, one of the ways that they would treat the lockjaw part is tinctures of lobelia with some other herbs, and it works amazing. And so it's not very mainstream. I really doubt you could walk in any health food store and it's there. You know, there's a handful of health food stores that I've been in that have had it, but they're usually very old school. You know, they're not the new fancy stores. They're usually an old time herbology. And so Amazon, you just go on and get on Amazon. It's not expensive. It's like 10, 12 bucks a big bottle of last year. Well,
I don't know about you guys, but I kind of feel like I want all of those things. Would lobelia help with morning neck stiffness?
possibly. You know, I would take it like either at night when you go to bed or right when you wake up, and it could help with that. Yeah.
Now for like Troy with the lung thing.
Yeah, so with Troy, like Samantha brought up, what about Troy with his thing? So there's a little bit of a different thing with that. Like he's having a hard time taking breath, but it's also most likely because of inflammation. And so inflammation starts to be a little bit of a different animal. And so we're trying to cut down the inflammation so that he's able to breathe like that. Eventually, we probably would put him on lobelia, but it would probably be weeks down the line. I'd want to really knock out the inflammation first. You know, there's been a few people that, you know, family members and things that have gotten it. And, you know, we would treat them and we'd get the inflammation down, and then we'd switch over to lobelia. And when they followed through it, usually they did better, but, you know, not everybody was following through. So, you know, these respiratory issues post-COVID are, you know, there's a few people, it's been a year and they're still having symptoms. And so they had a lot of predisposition. You know, they had bronchitis and pneumonia several times. And, you know, the lungs already had like a thickening or a lesion, or you could say scar tissue, but it's not really the exact thing. But yeah, they're still having difficulty. And so you really have to start unwinding the lungs. So you kind of do them in steps, you know, rather than trying to shotgun it all at once.
All right. That's
Okay, so let's come up with a protocol for you guys. Since we have some sore necks and hips, let's see what we got here.
a new question did just come
Yeah,
up.
fair.
What oils / herbs would you recommend to improve focus and attention in individuals who have ADHD?
You know, my first go-to thing is, you know, rosemary, basil, petitgrain. But with ADD, ADHD, sometimes you have I mean, it's not sometimes, you have a paradoxical response. And so what I have used in the past has been like neroli, you know, petitgrain might still fall into that category. Like linden blossom. Even some of the chamomiles might actually produce a result. You might even be able to go to like vetiver. Because like something relaxing is actually stimulating, and something stimulating is actually relaxing. So when you're dealing with a plant, sometimes the plants start to regulate things, and so you have to kind of experiment person to person. Let's do this. I'm looking for a protocol, but let's just do this. Pull out something that's cleansing or relaxing. So it could be something like chakra root cleanser or hyssop, Palo Santo, or if it's relaxing, marjoram, basil, petitgrain, even lavender. Okay, let's go ahead and have you start just inhaling a little bit. Just take a few long, slow, deep breaths. What wheels does Mary have?
She just got up. I think she's going to.
So begin inhaling. Your awareness is on the soles of your feet.
Someone wants to know if Delta is relaxing for them.
Sure.
You said the soles.
Soles of the feet. Then move to the ankles.
And what's this?
We're relaxing the body, healing the body. We're just doing a little exploration. Galbanum could be another choice if you don't have something, but this is going to be an exploration, so to speak. So your awareness on your ankles, the front, the sides, the back of the ankle. Okay, now anywhere in your feet, the heel, the sole, the pads up front, the toes, a joint, anywhere in your feet where you feel some pain or discomfort, hold your awareness on that achiness or that tension just in your foot, and take long, slow, deep breaths with your awareness on that area. Okay. Keep on that area. Long, slow, deep breaths. Find another spot in your foot where there's some tension, achiness, soreness, tightness, just whatever it is. Long, slow, deep breaths. Move up into the ankle area, just some sort of tension or awareness, tightness, tension, and anywhere in the ankle area. Inside, outside, front, back, wherever it is. Now move up to your knees, the front and back knee. Your awareness is on the front and back knee. Long, slow, deep breath. Now, explore along your shin and just find some tight spot in your shin from your front knee all the way down to your ankle along your shin bone. Find some area where there's some tension or tightness. Entirely shake to break. Now just be still for a moment. Just be still, be aware, keep your eyes closed, stop inhaling, just be still. Inhale or apply vetiver or tarragon to the legs in a massage or a lotion. Begin inhaling again. Explore your calves. Tension or pain, achiness in the joints from the low area around your ankle all the way up to behind your knee. Hmm. Go to another part of your ankle, or excuse me, your calf. Just find some area or tension somewhere there. Okay, now move up to your hips, the sides of your hips. Keep taking long, slow, deep breaths. Now explore the front of your leg from your hip all the way down to the front of your knee. Just find some area there where there's some stiffness, achiness, or pain. Now go to the inner thigh. So from your groin all the way down to the inside medial knee, like the knee on the inside. Just find some area there on your inner thigh where there's pain or tenderness, achiness. Go to the outer knee, or excuse me, the outer thigh. From your hip all the way down to the outside of your knee, especially in that area mid-thigh. Just explore that area and just see where there's tension or pain, achiness. Put your awareness there on both sides and inhale. Now the back of your thigh, from your butt cheek all the way down to your knee, especially the area right above your knee on the back side. Like really explore for achiness or tension. Inhale and just let go. Let go of everything, just be still, be aware and let go. Begin inhaling again. Just be aware of different areas on each butt cheek, like your hips. Like really look for areas of tension or achiness, pain. Take long, slow, deep breaths into those areas. Even if they shift and change, just be aware. Keep working this area. Even on the upper sides, like up high a little bit, just kind of explore those areas. Sometimes we're not even aware of it until we have a little relief. Now move to your low back area. It could be in and around the spine. It could be along the belt line. It could be out wide, but stay in that low back area and just see where you find some achiness or tension and take some long, slow, deep breaths. Move to your lower abdomen, just directly on the front side. If there's any areas of discomfort, put your awareness on that area. Take long, slow, deep breaths. Go into your mid-back area. Check on your upper abdomen. Explore those areas. Go to your chest, your whole chest area. Any areas where there's tension, achiness, pain, tightness. Now go to the areas between your shoulder blades, your upper back. Go to the shoulder blades itself, the shoulders. Just kind of explore those areas, wherever there's tension, achiness, pain. go to that area on your upper shoulders, like where the shoulder and neck kind of meet, like over that tender spot where the shoulder and neck meet. Move to your back of your neck. Just explore the back of your neck. Any tension, soreness, achiness up to the base of your skull. The sides of your neck. The front of your neck. Explore the whole front of your neck. Move to the shoulders themselves, the armpits, and anywhere in the shoulder you feel discomfort. Move down the forearm, either on the front side or the back side. Go to the elbows, front and back of the elbows. Long, slow, deep breaths. Down to your wrists. Explore your forearms, front and back, and find anywhere there's tension, achiness, pain. The palms of your hands. Go up to your jaws, where the jaw hinges in front of the ears. Awareness is on your ear canals. Now, anywhere in your body where there's still some pain, discomfort, tension, achiness, put your awareness on that area. Just take some long, slow, deep breaths. Just be still, be aware. Keep your eyes closed, just be still. Your eyes closed. Begin inhaling something in your external environment that bothers you. A stress, a tension, conflict at work or in the house. Take long, slow, deep breaths with your awareness on the situation. Just be still. Let everything go. Keep your eyes closed. Just be still. Okay, think of something external again. Could be the same thing, could be something different. Long, slow, deep breath. Just be still, be aware, just let go. So this protocol is called the things you can do with a single bottle of oil. We just took one pattern and we went really deep on it with just one oil. And how do you feel?
And you can unmute, you can type in. Go ahead, Barbara.
Hey, Barbara.
Greg, that was wonderful. I totally get what Wendy was talking about with the popcorn thing.
Yeah,
Firing
it can
off.
be, sometimes it could be a little overstimulation because the lymphatic system is detoxing, or it could be a nerve waking up. So, yeah.
It was all over, so I'm more inclined to think it was lymphatic detox.
Yeah,
but,
that's probably lymphatic, you're right.
I also had the sense of a big release from the heart.
Nice.
Not uncomfortable. I don't know what it was, but it felt kind of significant.
Good.
And at one point, emotional release from my face. Is that common?
Yeah. Oh, that's amazing. It's amazing that you're aware of that. You know, so much of our nerves and our face are tied to expression, emotions, and actually even our self-esteem, self-image. And so, yeah, boy, that's a great one if you have a release from there.
All things I've been reflecting on of late. So
Yeah, yeah,
Thank
yeah.
you. Thank you so much.
You're so welcome.
What was this protocol called again?
It's just explorations of a pattern and an oil. Like we just took something and went deep. You know, you could do this with, you know, probably 40 or 50 different oils and produce, you know, 40 or 50 kind of similar but different results. But, you know, something that's relaxing, soothing, could even be pain relieving, you know, something for tension. Any of that would work.
Someone's shared, oh, they're relaxed. Marianne, would you like to share?
Yeah, I have nervous leg syndrome,
Mhm.
and it's especially intense this time of night. So for me to sit still at all is usually very, very difficult. And I felt like there was well, a relaxation and an opening. And
Good.
although I still felt discomfort, it was bearable. And
Okay.
I was surprised that I could sit here the entire time. And at the very end, I was very aware of a lot of tension in my neck, which I'm not usually aware of.
Uh-huh.
And it seemed like there was some kind of a release there. But it was a very interesting practice.
Okay, and so you're the one that asked for the restless leg syndrome?
No, somebody
No,
else.
somebody
No.
else did.
That was somebody
Okay.
else.
Yeah, we'll
But
come up with something and we'll get it out to you guys.
Oh,
It'll
that
take
would
me a
be
little bit
wonderful.
to work. but
Yeah. Thank you.
Yeah, it's great to see you, Mary.
Great to be here.
Someone shared, my grumpiness got untangled. Oh, the places you'll go with one bottle of oil.
Yeah.
Fabulous protocol, very empowering. I have a whole new relationship between my awareness, my body, and oils. Very exciting to have this. Thank you.
Good, good.
Very wonderful. Thank you so much. taking your time to do this. And relieved a lot of tension.
Yeah, it's a good way to flesh things out. I mean, and you could use a lot of different things for it too, so. Yeah. Okay, you guys, I got to run into my next meeting and everything, but I hope you enjoyed and yeah, we'll talk to you again very soon.
Mhm.
Thank you so much.
Love you guys. See you soon.
Thank
Thank
you.
you.
Take care.